Well, we all know the world of aesthetic medicine offers tons of options for achieving a new you. Well, sometimes you need more than just an injection to fix what's wrong. And when searching for a plastic surgeon, there are a lot of things to consider. To help make that choice, I'm joined by Drs. Treece and Susan Vasko, both from Columbus Aesthetic and Plastic Surgery. So good to see you both.
Thanks, Robyn. Nice to be here.
Thanks for having us.
All right, so one thing to consider is the fact, I think, that Columbus Aesthetic and Plastic Surgery has been named a Consumer's Choice Award winner, we're talking, since 2012. So, Dr. Treece, I imagine you and your colleagues take a lot of pride in the fact that this is coming from the fact that patients trust you. They respect you.
Well, our goal since we started together in the 1990s has always been to give the best patient care. Board certified, sorry, I'm dealing with a little cold.
That's fine.
Plastic surgeons are what you want to look for. And it's all about providing safe, conservative, reliable results. And that's what we've always strived to do.
So when we talk, Dr. Vasko, about a board certification, what does that mean? Is it extensive training? What goes into that?
Well, a board-certified plastic surgeon has gone through residency, typically some combination of general surgery training and then specialty training in plastic surgery. And at that point, we take 2 exams. First is a written exam that you need to pass, which is usually in your first year of practice, and then a oral exam where the board has you collect cases for a period of time, you submit your cases, and then you get examined on how you handled that specific case and also how you would handle kind of unknown cases presented to you. So it's pretty rigorous. It isn't easy to pass both exams and get all the training done, and so it really is a stamp of approval from our board, the American Board of Plastic Surgery, that they feel that you are safe and qualified to be out in the world taking care of patients.
And unfortunately, those who sometimes go to a plastic surgeon who does not have that, Dr. Treece, you probably hear some stories of maybe results not being up to par in that case.
We do, and a part of our practice is helping to correct things that are not done quite as well as they might be. The practice of plastic surgery is knowing anatomy, function, and then a sprinkling of art on top. You have to be smart. You have to go through the right steps to get the job, so to speak. But you also have to have a good eye. Not everybody has that. So that's been a big part of what we've focused on over the years, is trying to provide a good quality result for people. And sometimes when things fall short elsewhere, we help tune things up.
Help tune things up. That's exactly right. Okay, so let's talk about some of the surgeries you perform, Dr. Vasko, and I am sure there are many of them. So, talk about kind of maybe the most popular things that you see a lot of people coming in for.
Okay. Well, one of the things I think that most plastic surgeons enjoy is the fact that we do lots of different operations, and you're not going in every day and taking a gallbladder out or something like that. You can
the variety.
So you can have kids, you can have older people, and so forth. And so one of the fun progressions is we don't oftentimes see one patient once and then they're gone. You may see a woman come in younger and maybe want breast augmentation. Then she's had a few kids and she has a tummy tuck to get things back in shape. Maybe develops breast cancer and we do breast reconstruction. Also, guys come in with weight loss, need to have some body contouring done for that. And then as they get older, facelifts, eyelid surgery, some of the non-surgical things in terms of lasers and, of course, skincare and those sorts of things. So lots of variety of all age groups, both genders, both reconstruction, which is, very important for people going through troubling times, either with cancer or trauma, and then also the aesthetic side of the practice.
Yeah, and I think that's important. A lot of people always think about the aesthetic side first. That's not always, obviously, the most, important or maybe life-changing surgeries for a lot of folks, and that could come. So you are celebrating a big milestone at CAPS, Dr. Treece, right? 20th anniversary then?
It's been 20 years. I can still remember calling Sue up and saying, because we've always been good friends, and we went through residency together, hey, let's join up our forces together. And I think we've had a great time over the years doing this.
You've had a great run, yeah. And you even said today when I said, you know, who's going to answer what question? You say, oh, we've known each other just a little while. I think we can figure it out, right?
There's a trust factor.
And as you mentioned, of course, a trust factor between you, between your patients. So how do you tell somebody, you know, to come on in? What if they have a question? Should they call? Should they come in for a consultation?
Well, we have a really knowledgeable front desk, so call, make the introduction, and they'll help guide you through the process. It's actually really easy. We have 5 board-certified plastic surgeons. Our schedules are really good, and I think we've organized it really well. And I think people will see that their experience when they come through the office is very enjoyable.
All right, again, celebrating 20 years and, of course, a Consumer's Choice Award-winning business. It is Columbus Aesthetic and Plastic Surgery. Thank you both for being here.
Thank you.
For having us.